right, we're out here on like I guess a public health visits, and I'm here today with this wonderful person.
Hi.
You want to introduce yourself?
My name is Kathleen. I'm a public health nurse with Chinle Service Unit, and I cover Nazlini, Chinle, and Cottonwood Salina area. So today we're out here doing a home visit, and I'm just showing Nikita. I'm just showing her around. So we actually went out on a home visit, and this is one of my case management. So as a public health nurse, we have cases that we manage every month or every day, every other week. We have cases like that. We go out on consults. We get consults from providers, and we do home visits pertaining to like postpartum visits, newborn visits, prenatal visits, and then also high-risk patients. If we get consults on high-risk patients, like let's say they're fall risk, we're going out there sometimes for welfare checks, medication reconciliations. If they have a wound, we don't do wound care, but we try to teach the patient or the family how to do their own wound care, or else introduce a home health agency so they can come out and start doing wound care, dressing changes for them. We work closely with CHRs, outside resources like social service, who else? Adobe, if there's IPV involved, or any type of abuse involved, we work with those resources. We work closely with medical providers, and then also we receive outside referrals, outside facilities. Like for us, outside facilities is going to be like Sage, Fort Defiance, Shiprock, Tuba City, Flagstaff, Gallup. So if a patient goes outside of our service unit and gets care at those facilities, and if let's say they got labs drawn and their labs were abnormal, they will send a consult from that service unit back to us saying that, hey, so-and-so was seen over here and their labs are abnormal. Could you please follow up, So that's how we collaborate with outside resources and facilities.
Wow. Yeah, you guys do a lot to kind of go out into the community and help people where they're at, right?
Right, yeah. We also do a lot of flu clinics. During the fall, we work with the community, set up flu clinics in their area, drive through flu clinics. This year, we're going to be doing influenza and COVID. I think RSV as well. That one's still up in the air right now, but we've got our places situated and confirmed. We're now working on sending out the flyers to the community. That's what we're working on right now. At the same time, with community health nurses, this year I'm also working on community assessments, and so that assessments we do every 3 to 4 years, and that community assessments just lets everyone know how many people are in that community, the population, who's their chapter officials, what resources they have in that area, and stuff like that. So we kind of highlight those things in that community assessment report.
Wow. So what kind of things do you see when you're out in the community, and what do you feel like are some of the challenges that people do face out here, since you're the ones who kind of actually see a lot of it firsthand?
One of the challenges is, of course, the road system. We went to the place where I guess they got rained out last night, and we have these really nice cars, and these cars are not built to run in the mud or be in the mud and stuff like that. So we have those challenges. Like if your tire goes flat, we have to change our own tires, maintain this vehicle first of all. We have to know when the oil change is going to be happening and stuff like that. So that's one challenge. And then getting to the home, if they got rained out, it's going to be hard. You might have to walk quite a ways to get up to a patient's home during like the monsoon season, or winter's challenging. The roads get icy and slick, especially when you go towards Chinle area. The other challenges is a lot of our patients don't have cell phone services, good cell phone services. So when a provider is like trying to call them if they want to update their patients about their labs or new appointments or whatever, and they can't get a hold of them through their cell phones, then that's when we get the consult and say, hey, can you visit so-and-so? They have an important appointment at Flagstaff. Can you just let them know? And so we just make that home visits out there. Some areas are iffy, meaning that it's a dangerous area to go there by yourself. So you gotta have someone with you at all times, either because maybe the CHR told you that that camp right there, they sell drugs, so do not get out of your vehicle, or that person is very inappropriate, do not make a home visit by yourself, you know. So we have cases like that, and then just some places are it's just grandma and grandpa by themselves, and you just do as much as you can with them. So of course in our area, specifically here on the Navajo reservation, speaking fluently in Navajo is a plus. So you can have that conversations with your Che and your Masana. And then of course with the K-teen in the background, that's always a plus.
Added bonus.
Yeah.
Yeah, what are like kind of the hardest visits that you've had to make, if that makes sense?
Some of the hardest visits are like when you bring like education into that family. A lot of places feel like it's third world country, and so you try to motivate a certain family, like these are the resources here for you. Sometimes you bring the resources to them and you leave it up to them, and sometimes it just stays there. They don't motivate themselves to better their own environment, better themselves. But for us, we're all about primary prevention for patient nurses. So you bring education into the home or into the community, into the chapter homes, and then you bring resources and stuff so that you know whoever you're talking to knows that that resources is available for them, you know. And then we also work with referral systems too, like if someone needs help, let's say, and a lot of families have like 3 or 4 generations in one whole household. It might just be a 1-bedroom house, and you'll have like 6 families in that home.
Right.
And one family might be asking for assistance trying to get into Navajo Housing Authority, and so we can just help out. I usually just help out by writing a referral on behalf of their situation, and just let NHA know that hey, this family needs a home. And I think Navajo Housing Authority works with point system, so the referral helps, you know, add to their points and gets them into a home sometimes. So at times we do referrals for them like that as well, or maybe a referral to another program, TANF or something like that, you know, WIC, Women, Infant, and Children program. And then within our own hospitals too, like if they need assistance going into behavior health or mental health, then we can do as well. And so, and it kind of also helps us to see, what areas we need to work on, and if we see a positive screening, the referral process starts with that. We start referring them to other resources to help them get on their way of becoming a healthy person.
Yeah, I see. Yeah, especially because, like, my understanding is that a lot of homes out here don't have a lot of resources, like even water and electricity and those kind of things. Is that a fair thing to say?
Yes, it is a fair thing to say, and I think with this, when COVID first hit, I wasn't here living on the Navajo reservation when COVID hit, but I lived in a different reservation. But when I hear back about what went through here, of course, a lot of our people that live way off the highway system, they live in a rural area, a lot of them don't have electricity, they don't have running water, and COVID really hit those families out there. Hand washing was something that was very challenging because they didn't have running water. So back then, I think our president at that time was Jonathan Nez. He did a lot to bring like hand washing stations to that type of family.
Oh, yeah.
And then bringing water to those families was a necessity, and that happened. And then the need for all the schools shut down, and so how are kids gonna go to school? So internet was something that was really needed at each household, and so he helped push that program through. And so a lot of homes now have internet services, and that was a huge communication thing that brought like the provider to the family together. So the provider was able to talk to a patient, COVID positive patient like that. So, and that wasn't there before COVID. So COVID in a way brought out a lot of good things, and it shined a light on a lot of things that needed to be shined on, like communication with the Wi-Fi, water. These people need water, good road systems, so and a lot of other things, I understand. So, and then the resources that we have, our resources are so limited, and we work with what we have. We're always improvising, and working well and collaborating with all these resources is what we do best, because it's like a team. We're all a team in this, and we're in it together.
Yeah. No, that's really good to hear. Because it's really crazy to think that, like, even a few years ago or even now, there's just places where people don't have access to the internet or the rest of the world or
Right.
community.
Right.
Yeah. And it's super important.
And
Okay.
And then the other thing was just highlighting what areas didn't have cell service. There's no cell coverage, and so we found those places as well. So and it was like almost literally the whole res.
You're like, which areas? And then you're like, oh, never mind. It's just everywhere.
Yeah, everywhere was red.
Oh my gosh. Okay. Well, to end it, any silly or scary stories, anything? Like any stories you want to share?
Well, when I first became a patient, like hot off the press patient, I think back then we were also working off of consults, and so, but I got a phone call, and this phone call was about two patients that had their medication changed, and this phone call came from behavioral health, mental health, and they wanted me just to do a follow-up to make sure that the patients are taking their meds and that they're doing fine. So the medication change happened 2 days ago, and so on the third day is when I got that phone call, and the provider says just go over there and follow up and make sure they're taking their meds, and if there's any changes or anything that you see. So I'm like, okay. So I get my whole gear bag, get in my vehicle, I go to the home, and a lot of times for me, I have this gut feeling. Like if I approach a home, you have a gut feeling that says, do not get out of your vehicle, just honk. I had that gut feeling with this visit. And I thought, okay, I don't know, but I'll just knock on the door. I'll walk up to the door. So I knock on the door and nobody's answering. I knock again and then the door opened. And one of the patients just, as soon as she opened, she's like, help my sister. She's down. She's blue. She's not breathing. And I was just like, okay, I'm not going in without my bags. If I have to do CPR, everything is in my bag.
Right.
So I came back to my vehicle, grabbed my bag, and I went inside it, and it was immediately dark. It was so dark, and when I walked in, my eyes started to like sting, and this smell just overcame me. Like, oh my gosh! And I'm trying to look. I stood there for a while, and then I saw a path.
Oh my gosh.
So I guess the house was like a hoarding house. There was just a small path to the back, and I kind of hesitated to go to the back, but then I'm like, the other patient is like, hurry, she's not moving. And so I went in, I followed her, and then I saw another patient, the other patient just sitting there, just kind of rocking back and forth. There was light, but it was so dim inside the house. And what was supposed to be the kitchen dining room area was just full of plastic stuff all the way to the wall. The kitchen was just like, it was not a kitchen, it was something else. And the whole time I'm going like this to my eyes, and
like plastic trash, or
I think it's just bags full of clothes or something, like laundry. It looked like laundry bags. And it was a 2-bedroom. Both bedrooms were just like full of boxes and plastics. It's just full. I couldn't tell where the patient slept. The living room was not a living room. It was just packed with plastic bags, and it was just a little path. And I said, I can't see. And the one that was rocking back and forth says, we have two or three cats in the house. We can't see them, and we don't know where they are. So I figured it was the cat pee that made my eyes sting.
Oh.
And it was literally, that house was a litter box too. Kitty litter box. And so I'm like, okay. So I got my eyes all situated, and everything looked fine. The patient wasn't blue, was breathing fine. So I'm like, okay, I'm just gonna check their meds. I asked both of them, how are you guys doing? I heard you guys had your medication changed. And the other one that was rocking back and forth, she was just like, yeah, we got our meds changed, but I don't know if I took them. I'm just so upset at my sister. She did this to our house, and she was just pointing at everything in the house. My mom taught us that we shouldn't live like this, but it's her fault. They were blaming each other. And so I let them do that while I'm checking the meds and everything. And then I gave the other patient a napkin. I cleaned her face because it was just dirty. So I cleaned her face, and I told her everything's all right. And then the other one, she's just like, she started saying, hey, come on, since we both don't like this place, let's just all do a suicide pact and kill ourselves today and let it be like that. And I was like, nobody's gonna die under my watch. I was like, no, that's not gonna happen. And the other sister gets up, she starts walking. So I'm just glancing at her. I'm fixing the meds here. I got the meds bottles and everything open, and I'm just trying to fill up their med boxes. And then the other one thought, come on, sister, let's just do this. And she ran after her older sister, and I'm like, I couldn't follow because it was just a path. So I thought, I'll catch them on this side. So I went around, I dropped everything, I went around to meet them, and I only saw the older sister coming out at the corner, and I couldn't see the other sister. So I'm like, oh no. So I ran back to the kitchen area, and I saw her standing away from me, and all I saw was this motion.
No.
And she had her wrist there on the counter, and that's all I saw, like this. And I'm like, it just, instead of me running out calling 911, I ran to her, and I just kind of went around her and I stopped her.
Mm-hmm.
She had a knife, but I think it was very dull because I didn't see like any blood or anything. And then I told her, drop the knife, you don't need to do this. She dropped it, and then I told her to step away from the counter. She did. I grabbed my phone, and then I also grabbed anything that looked like a knife or that was sharp in the drawer. Because she was grabbing, I grabbed everything, and I didn't know where to put it because it was just, everything was just like up the wall, and I just threw it up in the wall. I turned around, and she was still looking, and I'm trying to call 911 here, and we're still grabbing stuff. Somehow I called 911, and I said, hey, I'm at this place. Can you please send the unit? I need help right now. And by that time, the other sister comes out. She's crying, and she's saying all these things about her other sister. And I was like, okay, I think I got everything that was sharp away from her. And I told the other sister I was coming, come with me. And I just kind of ushered her into one of the bedroom. I quickly looked around. I saw a box of yarn, and I gave her, here, separate the yarn. And I gave her one, and she just started doing this, and I closed the door. I went back, and the other sister was like still searching for something like a knife. And I don't know, I could have gone out, but I stayed. I went behind the counter, so she's watching me this time. And I'm like, oh crap, I am in trouble. I have no way out. She's blocking my entrance to the out, my only entrance. And that look, I can still see. It was really scary. And then she's looking at me. I'm looking at, so the counter's overhanging this, or the cabinet is overhanging the counter, and I'm looking down. I have my phone light on her, and then all of a sudden she just falls over. Oh. And I'm looking at her, and it looks like she's seizing, you know. Oh. But she keeps looking at me like this, like she knows what she's doing. And I'm like, okay, she's fine. The lips are not blue. She's looking at me. So I just let her be. And then I'm over here like, I'm trying to get out. She knows I'm trying to get out. And then just out of that seizing. And so I'm slowly making my corner turn to dash out to the door. She'll stop. And then she'll kind of look at where I'm at, and then go back to seizing again. So I'm like, okay, she's fine. And then all of a sudden, just out of that seizing, she just sat up like this. Oh. And then I just stood there like, oh my gosh. And she goes, aren't you going to help me? I'm seizing over here. And I'm like, no, you're fine down there. You're fine. Your lips are not blue. You're breathing okay. You're fine. And then she's like, okay. And she just falls back and continues to seize. And then I heard a knock, and it was a police officer. Oh. Gosh, it felt like it was all day waiting, but it was probably just a few minutes. And the lady was like, hey, this is police officer. She was a lady cop. And I said, I'm back here in the kitchen. And right away, the patient jumped up, and she's like, oh, hi, officer. And I'm all like, I saw the police officer. So that week, I ran into her 3 times, and she's like, oh, Kathleen, you again? Now what?
Oh my gosh.
And I was like, oh my gosh, thank you for rescuing me.
To the police officer,
yeah.
Right?
And that whole time, I guess, somewhere I got shanked, and I got a cut. I think it was right here.
Oh, I see that, yeah.
I got cut, and I don't know from what, when, and all that. And so after that, I'm like, okay, I really don't know how to defend myself. So yeah. I'm going to have the security come over and teach all of the PHN department what not to do and what you can do. I'm pretty sure I made a lot of mistakes at this visit. And that's what happened. That was my
Wow.
scary story. And ever since then, I'm like, I always tell people, listen to your gut feeling. Like if your gut says, don't do something, don't do it. Or if you're going to a certain home, your gut feeling is telling you something, bring somebody with you.
Mm.
So, and I always go out with someone. Since then, I don't go out by myself. I always ask someone to come with me, just for support or help me with whatever, so.
Yeah, I feel like you handled that really well.
Yeah, but by the end of the day, that was like towards the end of the day, I stayed for another 2 hours. I didn't get out until 7 because I had to do the iStar. I had to fill out all these other forms. I got to get my Tdap shot, but the 2 patients ended up not staying there. They went into a facility to get further treatment.
Okay, I'm glad. I was gonna ask. I hope they got help.
Yeah, they did. They did, and I was just like, and I don't know what they did with that house, but I was just like, never again, Kathleen. Go last minute on a phone call.
Were there like no lights? Was it dark? Because there's just no.
There was lights,
Oh,
but
okay.
it was, I think it was like a 60 watts or something. It was so dim.
Oh.
And then with the cat urine, that my eyes were just so stingy.
Yeah.
Even the officer was like, oh my gosh, I said, yes, get me out. So we just literally just walked out. I got the patient out from the other room, and she just took him into her panel, and then I just left after her. I was just like, that was scary. It's like,
wow.
never again, Kathleen.
Wow. Thanks. Okay, thanks for being in this video.
You're welcome.
Yeah, thanks for sharing. Important things people need to hear, I think.
Right.